My name is Tracy Daniel. I'm a Psych NP student at the University of Massachusetts Global. This presentation is for the signature assignment for Nursing 641 Psychopharmacology Across Lifespan with Dr. Cleary, April 21st, 2024. Invega is a second generation of atypical antipsychotic. It is used to treat schizophrenia. It blocks brain dopamine and serotonin receptors to control neurotransmitters activity and reduce schizophrenia symptoms. The case that I'm presenting today is Mr. TD. Mr. TD is a 35-year-old Caucasian male who has been living with schizophrenia for a significant period of time. Currently, Mr. TD is taking Invega daily. He is a white man living in an urban environment, lives alone, and unemployed at this time. The main source of information is Mr. TD, along with healthcare providers and medical records. Mr. TD came to the office today complaining of worsening auditory hallucination, paranoid delusion, and disorganized thinking. Mr. TD has been suffering from auditory hallucination for the past decade. It is characterized by voices providing commentary on his action. In addition, it displays paranoid delusions and exhibit disorganized thinking, as indicated by his speech. Mr. TD is currently taking Invega daily. He has a past record of being admitted to psychiatric hospital numerous times because of his symptoms. He also had been trying other medications such as risperidone, olanzapine, and quetiapine. At this moment, Mr. TD denies any substance use. Nevertheless, he had a previous record of police substance abuse addiction. Mr. TD suffers also from high blood pressure, for which he takes lisinopril 10 mg daily. He has no known allergy at this time. For family history, Mr. TD's maternal uncle is schizophrenic, and also his dad struggles with substance abuse. Mr. TD has no developmental delay, although he has finished high school but has not been able to keep a job due to his symptoms. Diagnosis tests includes brain MRI, lab tests. Mr. TD came to the office, looked unkempt, tried to avoid eye contact, and has restless movement. He also exhibited feeling of sadness with limited emotional expression. Mr. TD has paranoid illusions and auditory hallucination. And also he has a lack of knowledge of the disease process and make bad decisions. The good thing about Mr. TD is willing to start treatment, but has no social support. Differential diagnosis for Mr. TD at this point is schizophrenia with paranoid type, schizoaffective disorder, substance-induced psychotic disorder. The treatment plans for Mr. TD will be to continue taking Invega and also include cognitive behavioral therapy, CBT, for psychotic support. We will also refer Mr. TD to a community mental health center for ongoing mental health care and social support. This case of Mr. TD stresses the importance of treating schizophrenia with a multidisciplinary approach that includes both pharmacological and non-pharmacological treatment. Recent studies have shown that Invega treats both positive and negative schizophrenic symptoms, which makes it a perfect treatment plan for schizophrenia. Culturally, sensitivity is needed to treat Mr. TD effectively. A typical visit with Mr. TD will include a lack of self-care, use of fragmented speech, may have paranoid delusion or auditory hallucination throughout the encounter. Despite everything else, rapport and trust is needed for effective therapy. TD, the use of Invega is suited for the treatment of Mr. TD. Second case study for this presentation is Mr. MB. Mr. MB is a 60-year-old African-American man who has Parkinson's disease and lengthy mental history. He cannot take Invega due to contraindication. Mr. MB lives in an urban area. He's retired. He lives alone but has support from his adult children who visits regularly. The main source of information for this case study is Mr. MB, along with his healthcare providers and medical records. Mr. MB came to the office, complained of worsening anxiety and psychotic symptoms, which interferes with his activities of daily living. He is currently taking levodopa, carbidopa for Parkinson's, clonazepam for anxiety, and quetiapine for psychosis. Mr. MB is also being treated with different type of medication. He denies any history of substance abuse and as well as any known allergies. Diagnostic tests for Mr. MB includes MRI or CT of the brain for assessment of abnormal structures, labs for metabolic abnormalities. Mr. MB came to the office well-groomed and very cooperative. He's a little bit anxious and a little guarded. He also exhibited auditory hallucination and a lack of knowledge for his psychiatric disease process. Judgment was also impaired due to psychotic symptoms. Mr. MB has a very supportive family network and is willing to start treatment, but his medical comorbidities complicate his medication management. Differential diagnoses for Mr. MB are psychosis due Parkinson's, schizophrenia spectrum disorder, delusional disorder, major depressive disorder with psychotic features. Treatment plan for Mr. MB is to consider adjusting current and antipsychotic meds and include a cognitive behavior therapy for psychosis symptom support. We'll also refer Mr. MB to different specialists such as neurologists and psychiatrists. According to Shikani and colleagues in a study conducted in 2020, they revealed that Invega is not appropriate and may worsen Parkinson's symptoms. For Mr. MB, healthcare providers have to be culturally sensitive and acknowledge Mr. MB's cultural background, values, and preferences, which is necessary for effective patient-centered care and optimal treatment outcome. A typical visit with Mr. MB will address several critical areas such as his Parkinson's disease symptoms, a detailed discussion that will ensure the effectiveness of his current meds, and the rationale for avoiding medication like Invega and definitely follow-up appointments. Invega may not be described for Mr. MB because Invega can worsen Parkinson's disease symptoms or cause extrapyramidal symptoms. It also can affect cognitive level and also have very strong drug interactions. Thank you for listening to this presentation, and references will be following. Thank you.